According to a 2016 National Survey of Children's Health Data that was published in JAMA Pediatrics, as many as 1 in 6 children in the United States who are between the ages of 6 and 17 have a treatable mental health disorder. These disorders include depression, anxiety, ADHD, and more. Mental health disorders can arise in children for many reasons, such as the presence of stressors in their life. Stressors can be found in negative environments, such as living in poverty and having unavailable parents or parents with their own mental health issues. Children are easily influenceable as their brains are still developing, making their home life a vital part in determining whether or not they are more likely to develop a mental health disorder. Children who have a negative home life and who are more exposed to stressors are more likely to have a mental health issue than those who have a good home life. So what constitutes a good home life and a bad home life? According to Mental Health America, the basic aspects that a child needs for good mental health are unconditional love from family, self-confidence and high self-esteem, the opportunity to play with other children, encouraging teachers and supportive caretakers, safe and secure surroundings, and appropriate guidance and discipline. These 6 elements all stem from a child's home and their upbringing. When a child receives all these things, they can be seen as having a good home life. When a child does not receive these things, and they have additional stressors in their life, they can be seen as having a bad home life. Stress has negative effects on the brain development and can impair their mental health. This stress can come from their family, such as living in poverty or experiencing recurring abuse, neglect, violence, or parental mental health or substance abuse problems. In terms of living in poverty and having poor housing conditions, children who live with leaking roofs, exposed wires, pet infestation, and other problems are more likely to have emotional and behavioral problems that expose themselves through anxiety, depression, and more. Parents who have a severe mental health illness are also more likely to live in poverty, which stimulates hardships for the children in terms of their parents' mental illness and in terms of their living conditions. These poor housing conditions may also create stress for parents, such as having food insecurity and housing problems, which can increase their own mental health problems and making it difficult for them to create a positive environment for their children and from using positive parenting practices such as warmth and responsiveness, nurturance, and supervision. This increases the risk for child abuse and neglect, which in turn can cause children to develop their own mental health issues. In fact, among children who live below 100% of the federal poverty level, more than 1 in 5, which is 22%, have a mental, behavioral, or developmental disorder. During the COVID-19 pandemic, children who had poor home lives faced additional challenges compared to those with good home lives. This mainly stemmed from them being forced to remain in that negative environment and them having to deal with the consequences of being there for longer durations than they may be used to. Parents were also faced with more stress during this time, leading these children to be more likely to develop emotional and behavioral problems as a result. This stemmed from most parents having to reorganize their lives in order to work at home while also managing their children's lives. When parents are stressed, they may create a more stressful environment for their children. Children who already live in less affluent households, or who live in households with mentally or physically abusive parents, or whose home life is not as good for some reason, may have their psychological issues be amplified. Children may be used to having an escape from their negative home lives by going to school or seeing their friends, but the pandemic hindered their ability to do that. Instead, they had to remain in these negative environments. Another way the pandemic affects the mental health in these children is how those with a poor home life may have had more access to resources to help them with their home life before the pandemic, such as through therapy. But when the pandemic struck, their ability to seek help became hindered because they had to quarantine and be socially distant from others. This was especially difficult for children who received therapy or counseling from their schools. Data published by JAMA Pediatrics show that from 2012 to 2015, among students who received any type of mental health service, 57% received it from schools. This shows how many children rely on those services. When schools or other places for mental health support could no longer be done in person, these children became untethered from their support. Without having contact with those who understand their needs, these children's mental health had the potential to worsen, especially if those children did not have access to a phone or computer to contact those trusted adults. Those who have private mental health professionals may have been able to continue their treatment over the computer, but those individuals were more likely to suffer. In comparison to those with a poor home life, those with a good home life often had better access to helping their mental health. Children who live in poverty are often faced with barriers when it comes to accessing mental health services, such as how those who live in rural areas often have to travel long distances to see a mental health care provider. Having a lower income or having a lack of insurance may also prevent these children from getting the help they need. Those with a good home life may be more affluent or live in areas with more mental health services, making their access to care easier. Additionally, those with a good home life may feel more comfortable asking their families for help. If a child has a poor relation with their parents, they may not want to tell them about their health issues for a number of reasons. Positive interactions between a child and their parent may alleviate this uncomfortability. It has shown that these positive interactions often even lessen psychological disorders in children, making them even less likely to need a mental health service. So, what kind of action can be done in response to this contrast between a good home life and a bad home life in terms of children's mental health? For one thing, since research has shown that many students rely on mental health services provided by schools, it is vital that the school districts work on strengthening these mental health services in order to provide the best care that they can for these children. In addition, many children who have parents with a mental health issue are more likely to develop one themselves. A priority should be created to make accessible health care for all people. During the pandemic, these mental health resources especially need to have more accessibility since it is often a time of greater stress for parents. Alleviating their stress alleviates a child's stress. One final thing is the relationship between a parent and a child. If you have a child, go talk to them. Go play with them. Make sure they know you care about them. Strengthening this bond may be the very thing that prevents your child from developing a severe mental health issue.